Let's study about placenta previa. In this scenario, they might mention maternal collapse or they might say there are normal vitals depending upon the amount of the blood loss, along with soft uterus. The two diagnostic words that will point out toward placenta previa are painless vaginal bleeding and a history of previous C-sections. What is placenta previa? It is a condition in which the placenta covers the cervical os completely or is located near the cervical os, which results in bleeding but without any pain. And bleeding is only from the maternal side, and it is also more dangerous for the mother. Risk factors include previous C-section, uterine anomaly, multiple gestations. This condition usually gets diagnosed at 20 weeks anomaly scan, and bleeding can trigger contractions in preterm labor. Investigations include CBC baselines, which includes serum electrolyte, viral markers, RFTs, LFTs. Next one includes the clotting profile, which includes PT and APTT. The most diagnostic investigation in placenta previa is transvaginal ultrasound. Management includes, when it comes from management, if the fetus or the mother are not compromised and are stable, you still have to do the symptomatic treatment and admit them till delivery in the hospital and plan either normal delivery or C-section. That is, pass the IV lines, CBC, baselines, clotting profile, cross-match, maternal and fetal monitoring, Foley's catheter, and arrange blood and transfuse blood. If you're planning C-section and fetus is less than 34 weeks, give steroids and check the rhesus status of mother, and if mother is Rh negative, give her anti-D injection. Let's see the scenarios are past paper questions. You'll notice the painless bleeding and vital signs are normal. And in the second scenario, only the painless vaginal bleeding is mentioned at 30 weeks, which directly points towards the placenta previa. You are done with placenta previa here. Let's compare it quickly with vasa previa. What is vasa previa? It is a condition in which the fetal vessels traverse the internal cervical os, which results in the rupture of blood vessels from the fetus side. It results in painless bleeding, but this bleeding is not from the maternal vessels, it is only from the fetus vessels. Vasa previa is always associated with artificial rupture of membranes or spontaneous rupture of membranes, and there is a very high perinatal mortality rate in this condition. If the baby is still alive until the condition is diagnosed, plan immediate C-section.